Shane, good morning. Good
Hey,
afternoon.
good morning, Brandon. Great to see you.
Hey, good to see you guys. All right, I think we'll get this kicked off. We've still got a few other people who are popping in. Just a couple of housekeeping items. We have muted everyone just for easy flow, not a lot of distraction and background. We would like to have some time at the end of this for Q&A. So if you have questions that you want to make sure that we get covered at the end, feel free to shoot them to me in an email, and I'll get those over to Shane and Jenna. But and my email is Brannon Brannon dot Brown at lpl.com. But without further ado, I want to introduce all of you guys to Shane Thomas and Jenna Padilla, who are going to be presenting today. Shane and Jenna work with Integrity Health Advisors. This is the third year that we've had the privilege of doing this webinar with Shane and Jenna. They are just wonderful resources on the complex and ever evolving topic of Medicare. So we're honored to have an opportunity to learn from you guys, Shane, and look forward to what you have to present. And without any further ado, we'll let you take it away.
Wonderful. Thank you. Thank you. Great intro. Appreciate it. Always a pleasure to be with you and your associates of clients and stuff. So thank you for having us. For some reason, I am off-site and my camera doesn't work. So maybe that's a good thing for you guys. You don't see me. You just want to see the presentation anyway. Um, so before we start, can you see my slide deck?
Yep, I can see it says Integrity Health Advisors.
Wonderful. Okay, thank you. So the two people on the call today, thanks for everybody that's on the call that's joining us. The presenters today are going to be myself and Jenna, and kind of our roles within the organization is, we are a brokerage house, and so we get the privilege of working with a group like Prosperion. And so what we do is we are the middlemen. We are the educators between you, the client, the prospect that's looking for a health plan, and the Medicare industry, let's say. So all that information that's floating around in space in Medicare, coming from the carriers, coming from the masses amount of stuff you get in your inbox, mailbox. What we're here to do is decipher all that, figure out what makes sense for you and how it relates to you at this point in your life. Not everybody's on the same track. So whether you're turning 65 or coming off of a group plan at 70, all these scenarios are different. So what you would do is you would quote unquote hire Jenna or myself to evaluate what's going on. And why I say quote unquote hire is we don't charge you anything. There's no cost for our consultation. Why we partner with Brandon and his clients is that we've been in the market for a long time. So 2008 is when I started the brokerage, and we have a lot of experience in the Medicare space in the day to day. What that allows us to do is be positioned in a way where we can help you eliminate a lot of the fluff and the information out there and go right to what's relevant in your particular scenario. Is a husband or wife controlling a group plan? Are you wanting to delay Medicare until you turn 70 or until Brandon says you have enough money to retire?
Uh,
Whatever the situation is, that's what we're going to try to help you with and educate you. And you, at the end of the day, pick a plan that makes sense for you. We help facilitate the enrollment in that plan. And that's how we get compensated is we get compensated from the carrier. And you need to be very clear that it never impacts the cost to you. So the plan can't cost more by coming through us. Whatever Medicare has released or the state of Colorado has released, it is a market rate. So you would really go back to that scenario as you would hire us for the education and the advice. Um, Again, hire us for no cost, and then hopefully we earn your business by saying we know what we're doing and we help you out. And then that's how we build a relationship when you come into the Medicare space, plus when you're in the Medicare space. So I want to introduce Jenna here. She's my lead Medicare advisor. We are right here in the Denver metro area, which I presume most of you guys are, but if you are not, we are national. So we hold licenses in almost every state but four. And if I see a need to go get Hawaii, maybe just for a vacation, I will go ahead and do that. But at this time, I don't hold a Hawaii, Delaware, um, Alaska, and one other one that always seems to slip my mind. But anyway, if you originate in Colorado and you move, that's why we've done that, so we can continue the relationship when let's say retire and go to Florida, Arizona, Texas, or whatever. But anyway, this is me. I'm the principal of the company. Jenna Padilla is the Medicare advisor. So most of the time you'll work with her. Right now we are in Medicare's annual enrollment, which I'll get to a little later. And it's just a crazy busy time of reevaluating what's going on in Medicare and um, the differences that's happening from 25 to 26. So she is extremely busy doing policy reviews and all that stuff. So if Jenna, if you want to say a quick hello, I'll let you do that. And then I'm going to have her jump off and then I'll conduct the presentation and answer questions at the end.
Hi everyone, I'm Jenna Padilla. I just raised my hand like you can see me, but you can't. I do recognize some names of people that are, on this call. So we appreciate you coming back, seeing us, and I look forward to helping you guys in the future.
Awesome. All right. I'll let you jump off and then I'll let you know how everything goes and if we need anything as a follow-up. Thanks,
Okay,
Jenna.
awesome.
Okay. All right. So let me move over here. I'm sorry. I am working from a different workstation, so I'm a little lost here. Where is my mouse? There we go. Come on. Okay. All right. So for us, the way we differentiate ourselves from other brokerages or advisors in our market is really with service. I think that's really where my business really comes from, is really education and service, since we're all representing the same plans, cost is the same. So you're not going to get a quote unquote cheaper rate by shop around. You're just going to get the knowledge and service that you hope that you get with us. And again, with our relationship with Brandon, if we failed there, I think he would fire us. Hopefully we're doing a good job and we get invited to come and talk every year, which is amazing. But I'll use our acronym here, IHA, if we're talking about us, but it's Integrity Health Advisors is the name of my firm. We specialize in Medicare, but if somebody is turning 65 and then a spouse is 64, we're able to help the younger spouse on an individual plan. So we'll never leave you high and dry. Or if your kid turns 26 and gets bounced from your group plan, we can help them as well. So just know that we're kind of fit for all the different avenues. Today's conversation is really more housed around Medicare. Um, Biggest thing that we want to always stress is that we work for you, right? Right? We don't work for the carrier. We don't have something that's in the background of why we do what we do. We work for you. So as long as we can be a good advisor, educator, that middleman, you'll see the need for our service when you go into Medicare space and review your plans every year. You'll keep using our services and we'll stay in business for a long time. So we have an office here in the Denver metro. So we do a lot of stuff via Zoom like we're doing today, Google Meet, phone calls, stuff like that. But if somebody is local here and wants to meet with Jenna or myself in person, we do have an office where you can come, and some people feel a lot more comfortable doing that. We're happy to accommodate. So let us know what makes most sense for you. But if you live in Hawaii, maybe I need to take a trip and get a license and we'll do that. Anyway, I don't know why I'm so focused on Hawaii, maybe because it's a little gloomy outside. But anyway, I digress. So the conversation today is a couple of aspects is what is Medicare? Who's eligible for Medicare? What options are available? How do you enroll in Medicare and choose the correct options? And what resources are available to you? So these are things that are going to be questions that people coming into the Medicare space are going to go through. And like we said, we've been through them a million times. And so we're here to kind of guide you and kind of streamline that, not in a quick way, but in the most direct educational way for you. We will definitely go through all the options. So we're not privy to one carrier, one product line. So that's where it goes back. We work for you. And so we will find what your needs are and what plan actually manages and fits that. And whatever it is, that's kind of what we'll help you with the caveat of do we hold a license to be able to represent that plan and product? From a legal perspective, we can't represent a plan that we don't have, or the carrier doesn't give us an opportunity to take a contract with. And we'll obviously be full disclosure on what that is when we meet with you. Okay. Um, so again, we're talking today on a Medicare 101 high overview. Everybody's going to have certain particulars in your arena. We're happy to discuss those. Most of those got to be offline one-to-one. But again, what we're trying to convey today is that general Medicare knowledge. So you can say, okay, I have a good foothold on what this is, and I have a resource I can reach out to. Obviously, I trust Brandon, and so hopefully he's done his due diligence of looking at different Medicare brokerages. You could always come and talk to us and then bounce whatever we say against somebody else and see, kind of who you really fit with. Is Jenna too personable with you? Maybe you don't like that. You need somebody more direct. You're going to kind of go through some of these things of figuring out who you want to partner with and who you want to build your Medicare relationship with. Um, so let's go through the first thing, like who is eligible for Medicare? We get a couple of words confused in our industry. A lot of times they'll say Medicare and Medicaid. We're definitely in the Medicare space. Generally thinking, when you're thinking Medicare, you're thinking somebody 65 and above. Again, generally, that's what we're talking about because we've got clients that are 30, 40, 50, 60, because there's exceptions to every rule. But typically, we're looking at somebody who's 65, has worked in the US and paid into Social Security for 40 quarters. They don't have to be consistent. They could have worked for 5 years, taken a break, raised kids, gone back, etc., whatever it is. As long as Social Security sees that you've earned your 40 quarters, Medicare Part A will be premium free. And we'll get to that here down the road, or a US citizen and a resident for 5 years. So why that's kind of relevant is if somebody is here, they bring mom or dad from, obviously you can't see me, but I'm Indian. So what if I brought mom and dad from India? They've never worked or, paid into the system. Well, if they're here for 5 years, then they can pay into the Medicare system. And that's something that people will evaluate. The big exception to that 65 window is whether somebody is on disability through Social Security. They can't just come to me and say, "Hey, Shane, I haven't been able to work." It's, I filed for disability, Social Security acknowledges it, sends me a disability check, and then 24 months later, they will get health care through Medicare, through their disability. And so those younger individuals were able to help. Okay. So, generally speaking, when we're looking at Medicare, people will come to us and say, "Hey, I need to do something because I'm turning 65." And then we talk to them and say, "Okay, based on your scenario, what do you need to do? And maybe what can you postpone?" So we're here to guide you along that path. But really, what you want to think about is your birthday month has 3 months before and 3 months after that are very critical. So my birthday is August, so let's use that as an example. Obviously, I'm not 65, but if I was, I would look at those 3 months before August, the month of August, and 3 months after. That 7 month window is what Medicare calls my initial enrollment period, my IEP. I need to do something. So based on what my current healthcare is, will dictate what I need to do. So if I am, let me just throw out a couple examples. If I am turning 65, I've collected Social Security since I was 62, I'm fully retired, I'm coming off of an individual plan, I am going to be going into Medicare. No questions asked. I'll already be enrolled into Medicare A and B because I collect Social Security income. I don't have any other health insurance. I only have an individual policy through the marketplace. I will have to drop that and go into Medicare. And I will want to make a decision with Integrity Health Advisors evaluation in months one, two, and three about what type of health plan I need that will then start on the first of my birthday month. That's one example. The other example I would say is what if there's a neighbor who is turning 65, is working for IBM, loves his job, um, and doesn't plan to retire till he's 70. That scenario is different. That individual we're going to talk to on month one and evaluate whether Medicare makes sense, whether his group plan is satisfactory. Does he have a low monthly rate, low deductibles, etc., or is it atrociously expensive? Is he paying $500-600 a month with a $10,000 deductible? And then we'll evaluate that and say, hey, keep working, but go into Medicare, or keep working, take your group plan, call me in 5 years, whatever. So there can be a lot of different scenarios. It's not black and white, and everybody has to do the same thing. So please know that. The reason why those 7 months are critical is if they don't have group coverage and they choose not to do anything. If I'm going back to my first example, somebody who's on the individual market, turning 65, and they just quote unquote are lazy or don't feel Medicare is necessary and they do nothing, and then a year or two later they enroll into Medicare, they're going to have what's called a late enrollment penalty. They were supposed to go into Medicare and they just chose not to or didn't know. So therefore, Medicare will penalize them for not taking Part B on time or not having a Part D plan. So we are going to evaluate that with you and go through all that stuff so that way you know the decisions you make during your initial enrollment window are solid, whether going into Medicare or not. So that way down the road, you are never going to be in a position of, I was blindsided, I got this penalty, I didn't know about it. You're absolutely going to know about it. Okay. So that is going into the Medicare space. All right. So we love the alphabet soup of Medicare. It may seem weird to you, but we do love talking Medicare. We think it's a great opportunity for people to evaluate their healthcare plan, find great coverage, things like that. We're well versed of the ABCDs of Medicare, and we do love talking about it, which is kind of crazy. But at the end of the day, what we love is that the clients are educated and find a plan that makes sense. I guess maybe that's what we love more than about the ABCs of Medicare. But Medicare has a lot of components, and they're all unique and different. And so you got Part A, B, those are from the government. So those are government health plans. Part D is regulated by the government. That's why you see government programs underlining all three of those. And then you have your private plans. Medicare Part D is a private plan. Medicare Advantage is a private plan. Medicare Supplement is a private plan. So we sometimes have clients that are like, oh, I have my Medicare Advantage through Medicare. I have my Part D through the government. No, you don't. You have it through a private carrier. So if I just throw out names like United or Humana or Cigna or something like that, those are the carriers that will offer Part D plans, Advantage plans, and supplement plans. And those are all private. So somebody like myself, as the brokerage house, we go out to these carriers and see if they're going to be a valuable asset to us to have a contract with, to then provide to you as an option. If I find a carrier that is subpar, doesn't meet service requirements that we would want, we may not hold a contract because we don't want to advise enrollment in a plan that we can't back up from a service perspective. So that's why we don't hold every contract. We hold majority of the contracts. And some of them are very regional. So if I'm working with a client in North Dakota, and there's a local plan there, They may not even give out contracts to somebody out of state. So there's a lot of little exceptions to the rule. But again, we're talking general today. So Medicare itself, when that common denominator between all of our clients is that they have a red, white, and blue Medicare card. Again, it's partly earned and partly paid into by the client. So it's a combination. So please don't go into Medicare and saying, hey, it's a social program. I get it for, I'm using air quotes, for free. It is not free. We need to educate is that you're paying into the system when you're working. And so your part of your FICA taxes is paying into Social Security, paying into Medicare, and then, you work with Brandon and saying, hey, when should I pull Social Security income? Is it 62, 67, 70? Again, that's why you have a great financial advisor to help you do that instead of having to do it by yourself. And then you'll have us on the Medicare side of saying, I'm turning 65. Do I go in at 65 or do I wait? So that's kind of the analysis. But once somebody has Medicare A and B, I call that their foundation. It is not everything. It is just their foundation. Once they get hospital and medical through Medicare, you need to look at other private coverages. You would look at a Medicare supplement with a Part D. That's what you see on that left-hand side. Or you look at a Medicare Advantage, which is right there on the right-hand side. I'll be completely honest, there's pros and cons to both. So please don't think like one is superior to another. It is always case by case. I can go on and on about pros and cons of the left, pros and cons of the right, and it's not going to fit everybody the same. It is going to depend on what county you live in. Yes, county is very specific. The state you live in, the age you are, a lot of factors going into whether we advise that client on an advantage or a supplement. I want to go back to saying
Gotta
we
look
don't
at
have
that because we're
anything.
changing counties, so we might need to look at that. We're
Sure,
changing
absolutely.
counties,
Connect
so
with
we
us
need
after,
to look.
Rose, and we will help you. So put yourself back on mute if you will. But we'll answer that at the end of the questionnaire presentation. Um, so um, Medicare Advantage, Medicare Supplement again is going to depend on doctors, network, cost, a lot of different scenarios on what's going to make sense for the member. One thing to also know is when you have a couple and you're covered by a group plan, it's always the same group plan. You have a primary and a spouse. In Medicare, you have two individuals. So therefore, one spouse can go Medicare Advantage and one can go supplement. It's unique for the individual. You don't both have to do the same thing, but a lot of times people do like to do the same thing just because that's common denominator. Okay, so after you turn 64 years and 9 months, that's that start of that initial enrollment period. That's when you can start making a decision of enrolling into Medicare. So we've seen clients over my, I don't know, 15, 18 years, start getting advertisement. Back in the day, it was 3 months before, and then 6 months, and then a year. Now clients are getting advertised at 63 about Medicare, and they're like, what? Why am I getting hit so early? It's just kind of how the marketing works, and people are trying to build relationships, way before, or clients are starting to go out and start getting educated. So, you work with your financial advisor at 63 and say, hey, Medicare is going to look at me at 65 on my 63-year-old income. So let's kind of work on that today. That's a great reason to reach out to your financial advisor, Brandon, or anybody in Prosperion and say, hey, I'm going to be turning 65 in 2 years. What do we need to do to adjust so that way my Medicare cost is not exorbitant, right? Just planning ahead. Amazing. Enrollment is automatic into Medicare if you're collecting Social Security. So please do know that. No penalties if you are late. If you enroll in A and B, you've taken care of the A and B penalty. We just need to look at Part D. Enrollment into Medicare, we cannot do that for you. We will help educate how to do it, or we will help facilitate the paperwork in order to do that. So we will definitely try to, not sounding childish, hold your hand through this whole process and making it as pain-free as simple as possible. Okay. All right, a big component of Medicare is Medicare Part A. A is an alpha. Um, Part A is what it is earned during your working career. So when you're paying into FICA, into Medicare, you're earning premium-free Part A. What that means is that once you get 65, if you earned premium-free Part A, you no longer have to pay a monthly premium for Part A. And so when somebody gets awarded Medicare Part A, what does that actually do? It actually is health insurance from the government for an inpatient stay. So if you are admitted to the hospital, client only has Medicare A, they do have hospitalization coverage. It is again, as I said earlier, a starting platform, but again, if they decided not to talk to us or do anything and they just had A, they would get coverage for these benefits right here that fall under Part A. Inpatient hospital, inpatient mental health, skilled nursing. The way I kind of look at it is things that involve a bed. So if you're over at the hospital and you're in a bed, that's going to come under Medicare Part A typically most of the time. Um, so if you do have Medicare Part A and they go into the hospital, because you've earned premium free Part A in our example, they don't have a monthly cost. They will have a deductible when they're admitted. So that deductible changes every year. We don't know what it is for 26 yet, but for 25, it's 1676 for day one in the hospital. So what that means is that there's a benefit period of 60 days. Day one, two, three, four, all the way up to day 60 is a one deductible of 1676. If a client leaves and comes back in for something else, it is a brand new benefit period. So another day one and another 1676 is what that client would have to pay. So that's why there can be multiple deductibles in a given year. So that is Medicare Part A. Again, sometimes people assume because they paid into Medicare so many years that they don't have anything to pay at the time of needing Medicare Part A services. That is very incorrect. Medicare B is in Bravo. This is the other component that's going to railroad track and be along with Medicare Part A. This one does have a monthly premium that the client is going to pay. This one is Medicare outpatient, so meaning same day services. Some of the services are um, going to your doctor, your primary doctor, your specialist, going in for outpatient service, so something like a cataract surgery or a colonoscopy, having an ambulance take you from home to the hospital, flight for life, taking you from a fall to a hospital, stuff like that. These are going to fall under Medicare B. So A and B are very different from each other. It's not one umbrella. So under Part B, you have a deductible. It's $257, but this time instead of per occurrence like A, it's a one time for the year. And that one deductible of 257 is the first thing that you'll pay when you trigger a Part B service. After that, you've satisfied it. And once you've satisfied your deductible, Medicare is an 80/20. So Medicare pays 80% and you'll pay 20%. 20% of what, you may ask me? I don't know. It depends on what type of doctor you went to, what type of service you got, what hospital you went to, what the rates are, what the billables are, a lot of different scenarios. So, let's just put out some examples for explanation purposes. If you go to a primary doctor, the negotiated rate with Medicare is $100. After your deductible, Medicare pays 80 and you pay 20. Simple math, right? But if you have an outpatient service and that cost or that facility is $5,000, now you're paying 20% of $5,000. And there's no maximum, meaning you can pay 20% and 20%, it'll never stop. It's just a 80/20 until, the year starts over and then you pay your deductible and pay 20% again. So we highly advise not to leave Medicare A and B by themselves. You will always look at some sort of private plan. So A is hospital, B is doctors, D is pharmacy. So D is where you would get your prescriptions from. Medicare regulates it and puts all the rules together, but it's always offered by a private company. So an example would be you go to see your cardiologist, they prescribe you a blood thinner. You would go out to Walgreens, you would fill your prescription with a private plan, let's say Humana, and then there's a cost benefit analysis there of deductibles, copays, or whatever, and then you pick up your medication. So it all comes from different lines of insurance. Part D is very important to have. You could maybe be on the phone and say, "Hey, Shane, I don't take a single medication, so I don't need Part D." I am from the protection standpoint of advising you, please do get one because insurance is just in case, right? If we knew we weren't going to use it all year, that's amazing. You have a great crystal ball. We don't have it. So if something happened to you and you got in an accident or you developed a chronic condition, we need a Part D sitting there to help offset some of the cost of your prescriptions. All right. With Part D, it's probably the most confusing, so I've tried to make it as simple as I could here and saying there's three stages of Part D. The first one here is does your plan, because each Part D is different, does it have a deductible? So if that deductible in 2025 was 590, let's say you met it, after that, that's when you pay your cost share, meaning copay or co-insurance, where you pay something and the insurance carrier pays something. That's but in order to get to that cost share, you have to go through your deductible. After that, you get into your initial coverage and say, I've met my $590. Now I'm going to split with the company. So let's say Humana is your insurance carrier and you have a tier three copay or tier three prescription and it's $47 to you. And let's say the carrier pays $253. Well, that's a $300 med, right? And so that $300 goes toward that $2,000 of 2025 max out of pocket. In 26, that's going to be $2,100. Why that's really important is if that beneficiary hits the $2,000 ceiling in 25 or the 21 and 26, after that, they get into catastrophic and they are 100% done in paying any out-of-pocket expenses for that prescription. So again, going back to my previous example, a healthy person that doesn't need a medication plan, you do because what if something happens and all of a sudden you're on a really expensive heart medication or whatever? If you don't have a Part D, you're paying for that medication 100% on your own. If you have a Part D plan, you're sharing with the carrier, you have a $2,100 max, and now all of a sudden, all the financials that you've been working with Prosperion on, you're not burning through just to pay for medications. You have assets to help offset that 2,100, and then you know you can still get the medical care you need because you have the proper health care in place. So, Medicare Part C, two words to describe the same thing. You may call it a Medicare Advantage plan. You may call it a Part C plan. We're both talking about the same thing. Whether you want to call it one or another, it doesn't matter to me. We're talking about the same thing. It just means it's a private plan that is going to manage all of your health care. So if you have A and B, you can be eligible for an Advantage plan if it exists in your market. And therefore, that private plan, which again does change year by year, and that's what Jen is doing today, is evaluating plans that people have in 25 and making sure it makes sense for them in 26, or is the plan even available? A lot of different things going on. But that private carrier then can choose to put together a plan of hospital, doctors, and medication, charge some sort of premium for it, or even no premium at all, structure the copays, structure the benefits, like do they add dental, vision, hearing? Do they, of course, have a max out of pocket? All these different things. That's what a Medicare Advantage plan would do. And Medicare Advantage, for our example here, is very similar to like a group plan. So if you're ever employed by a carrier or had an individual plan, that's what a Medicare Advantage looks like. It's very similar, but on the Medicare side. To be eligible for an Advantage plan, you must have Medicare A and B. You can't just have one or the other. You must live in the plan service area. So if, let's say, United Healthcare offers a plan in Denver, but doesn't offer a plan in El Paso because your sister lives over there and you want that plan, You can't. You have to have the plan available in the market in the county of where you live. Um, and then there are special needs plans out there. So maybe somebody has a chronic condition and wants to go into a plan because of cardiovascular issues. You would have to qualify based on your health. Some of them are qualified based on their financials. So just depends. But there are special needs plans out there, all specific to the county that the plan has been eligible to operate out of. There are what plans that are called Medicare supplements. Sometimes people call them Medigap plans. These are plans where you, again, have to have A and B, but now Medicare supplements are state managed. And so now it doesn't matter whether you live in Douglas or you live in Grand Junction and Mesa County. You would both be eligible for that same Medicare supplement because supplements are statewide. Also, Part D plans are statewide. Just Medicare Advantages are very specific to the county. So Medicare supplements have different enrollment windows than Medicare Advantage. They have a 6-month window where they are client would be in what's called open enrollment or guaranteed issue. So those two words that I'm using are key for the member because this is when they don't have to answer health questions. So if the plan is available for you in that open enrollment period or that guaranteed issue period, you can be eligible for the plan without having to say, these are my medications, this is my pre-existing conditions, and the carrier cannot deny you. That is very big. If you electively look at a Medicare supplement in month 6, 7, 8, or whatever, the carrier is absolutely allowed to ask you medical questions. So if you just came out of the hospital, just finished cancer treatment, or take a blood thinner or have diabetes, you may be rated or declined. That absolutely can happen. If you're like, hey, wait, I thought plans had to be guaranteed issue, you can't be denied. Might be cross-referencing that to the individual market. That's the individual market that we're talking about. So Medicare supplements and Medigap plans, amazing plans again for those that feel that that's the way they want to go. They will have a monthly premium. It will be attached to where you live, your gender, and your age and tobacco status. So that will absolutely be the baseline that we use to give you a proposal of rates. Now, the state can offer all these types of plans, A, B, C, D, K, L, G, etc. The private insurance carrier comes in and says, well, I don't want to offer all those. I want to offer 4 of those or 5 of those. They absolutely can do that. But once a carrier offers, let's say, a plan G, no matter whether you get that plan G through carrier X, Y, or Z, the coverage is identical because the state says so. So what's going to vary from one carrier to another is premium or any value add benefits that they provide on top of that. And sometimes clients are like, I'm very partial to United Healthcare. I'm very partial to Aetna because I had them for 30 years, whatever. That's maybe one of the avenues that we will use because that's what they feel comfortable with. But know that the plans are going to be absolutely the same. So this is kind of a great grid to kind of show you and highlight that when you get one of these plans, so I'm going to highlight G there, right there in the middle, and you see a check mark, that's what it's paying when Medicare doesn't cover that cost. So Medicare is your first line of insurance, and they will pay for Part A services outside of that deductible we talked about of 1676. So if you look at Plan G, it says, hey, there's a check mark next to Part A hospital. So that means it's going to pay that 1676. It's going to pay the Part B co-insurance. That's the 20%. So what does it not pay for? It doesn't pay for the Part B deductible. That's the 257. So somebody that says, hey, Shane or Jenna, I want Medicare A to be my primary. I want a backup plan with company XYZ. I want a plan G. How is that going to work? Okay, well, you're going to show Medicare first. They're going to bill Medicare. The difference is going to be paid by the supplement outside of you paying that 257. The third part is that you have no other expenses, right? You have a first and a second position, and then boom, you're done. It's very nice to have that kind of um, type of coverage where you have a first and a second, which you've never had during the working career. It's very different. So some people like that coverage, and they're willing to pay for it to have that. So the types of people that may choose it are people who are chronically ill, people who travel a lot, people who have the financial means to say, hey, I'm perfectly healthy, but I want this secondary policy in case something happens. So Medicare supplements, they are a bill payer. That's the terminology I use because they're a backup to Medicare. So what that means is the network is never dictated by the supplement. It's always Medicare's network. So A and B is primary, and the supplement comes in and says, what level of coverage do you have? A, B, C, F, G, whatever. And because of that, if we go back to the previous grid like this, how much am I responsible for paying? So whether you have an A plan or a K plan, that's what dictates the amount of coverage the secondary pays. So Medicare pays first, supplement pays second, and then you may have to pay third if you've chosen a type of policy like that. So the network of the supplement is never dictated by the supplement, and if Medicare doesn't pay first, the secondary cannot pay for it. So you can't bypass Medicare and say, hey, I'll just bill it through my supplement. It has to be a first and second position. The coverage is identical to across the country. So if somebody is sitting here in Greenwood Village and they get care, it's Medicare and the supplement. Now they're traveling and they're on vacation in Alaska and they get hurt on land, Medicare pays and the supplement pays the difference. The time it's not going to pay is when you leave the US and you go into international waters. You go into the international, um, you know, country of like Italy or France or whatever. Medicare is not going to cover you there. Okay. And once you get insured by a supplement, as long as you're paying your premium, you're guaranteed renewable for life, meaning that once you get the policy and then you get diagnosed with a chronic condition or whatever, they can't deny you because of your usage of the plan. As long as you're paying your premium and the carrier offers a plan, you're good to go. So, coming back to, we talked about a bunch of stuff in the last 40 minutes. Going back to the foundation is once you've earned Medicare Part A and enrolled into Medicare Part B, you sit down with Integrity Health Advisors and say, here's what my needs and wants are. Here are my doctors and my meds. We'll give you some options on Advantage, Supplement, and Part D. Again, of the carriers that we contract with, you pick one of those, we help you enroll, and then you're set for when Medicare goes in effect. But again, I want to stress once you get Medicare, please do pick a supplement with a Part D or an Advantage plan. Do not leave Medicare by itself. That's just word for the wise because it doesn't impact me, but it will impact you at the time that you need medical coverage. Okay. All right. So that brings everything together. We went through the A, B, C's, the Medicare. Hopefully you took something away. Like Brandon said in the beginning, I'd like to open up for Q&A. I don't know why Jenna never got off the call. Seems like she's still there, but I'm here. So I don't know if he needs to release you guys off of mute or if you guys raise your hands or put something in chat. Let me know. I will stick around here for a little bit to answer any general questions. Please don't ask me any specifics about yourself. If you need to, send an email to jenna@ihabreaker.com. Or right now you can go to our website and there's a link in there that says I need a Medicare appointment or an individual, and you're able to like fast track right on to somebody's schedule. So we don't have to play phone tag. You're able to text the phone number, email. We're really good about text and email just because we can get to you after hours per se. Um, Again, please be patient with us as we're on the phone or doing calls like this where we may not be able to take your call, but we will get back to you. So people that have worked with us know that we definitely will. Just again, just please be patient as this time is super busy, but we'll get back to you. All right, Brandon, I'll let you take it from here, sir.
Hey, Shane, thank you so much. Super helpful information. I did get some questions that came through on email, so I want to ask you some of those. Um, One of them was, what documents or information do I need to provide to enroll in a plan? Are there things that we need to pull together to get ready for that enrollment meeting?
All right, perfect. That is a really good question. So we've tried to streamline some of this stuff, and I understand some people are not techie, others are. The simplest way that we've got, I'll tell you, is that if we can communicate with you via email, we can send you a link and I'm seeing somebody's name is Kyle here. So let's say I'm working with Kyle. He sends me an email, says, "Hey, Shane or Jenna, I want to set up an appointment to talk Medicare with you." Great. We'll send Kyle a link. It'll allow him to put his name, his date of birth, where he lives, his county, his doctors, his meds, and sign what we call a permission slip. It's called a scope of appointment, which is what legally we have to have in the eyes of Medicare. So we get all these documents, and it comes back to us and you're allowed to able to set an appointment too after that, or we can do it through our website, whatever. But we gather that information that way, or the other option is we can set an appointment and then once we sit down with you, we can gather that information, but then that means we need a second appointment, right? So there's different ways that we can gather that information, Brandon. But
Okay.
the seamless way is if we can do it electronically and you're able to do that, that helps us, helps you gather the intel, and we can do some due diligence prior to our meeting, so we can talk, intelligently and say Medicare Advantage works for you or it does or doesn't, and we can kind of streamline that conversation, right? But we'll go as fast or slow as you guys need, based on kind of how you're absorbing the information or the timeline that you have.
Yep. Great. Thanks, Shane. The next one was, what kind of coverage does Medicare offer for long-term care, dental, vision, and hearing?
Okay, so first thing first is Medicare offers zero for any of that.
Okay.
So when you go in, you mentioned a bunch of different bullet points there. So long-term care, I would work with Brandon on. My advice is a standalone plan is really tough. So you would want to talk with him on saying, hey, can we get a life insurance policy that has a long-term care rider? That's where I would kind of push you to. Medicare, you kind of want to think of as um, a health insurance plan, so it's not going to cover room and board, which is really what long-term care is and stuff like that. So, dental, vision, hearing, we will always do it through private carriers, and we can help you find whether an Advantage plan has that, or we just provide that option independently, like a la carte.
Yep. What are the most common mistakes that you see people make when choosing a Medicare plan, and how do I avoid those?
So again, this is a bias for me. I think that people get information from a non-credible source, so friends or family that's trying to help them. They find some stuff on the web, like they go by based off what they've read on the news. Please do work with us because we're not biased to one or another. We know whether something in the news is factual or not. So mistakes people take is they think they can do it on their own, and then, which again, you guys are all probably super competent, but again, I talked with somebody the other day and says, my wife has a doctorate, I have a master's, but this seems confusing, so I'm glad I have you. Just please use us. There's no reason not to. And I think I saw a chat that says, how do we get paid?
Yep.
We
I was
get
going to ask
paid
you that
from the
one next.
carrier. So therefore, it doesn't impact you on coming up and just saying, having a consultation. There's no cost for that.
Um, any changes coming up to Medicare that we need to be made aware of? I know there's been quite a bit floating around.
Yeah, so I think like I'll just use the word inflation. I think it's really that's just a general term I'll use, but obviously it's super impacted on Medicare on which division we're talking about, Advantage Part D drug plans. But that's made a big stir on how the Advantage plans look year over year. So the cost to the client is increasing and the options are decreasing. Medicare supplements are going up in increases per year at a heavy, steady rate, but it's kind of like a catching up for the last couple of years that it hasn't gone up. So yeah, I would say that would be the big thing is looking at your plan today, if you're in the Medicare space, is it still available? The costs have gone up, so does it make sense to stay or look around? And has your network changed? Does your access to care stay consistent? So please do be aware of that.
And how often can you change plans, Shane?
Generally talking, I want to say once a year. So October 15th to December 7th is the big window. So some people can change outside of that. Most have to change during that window. So please don't miss that window.
Okay. I had a question about the Part D donut hole. What is that? How does that work? How does that affect folks?
Okay, Part D donut holes, the answer is simple. It's gone. It does no longer exist.
Okay,
So it used to exist. It's no longer there. Now you just go from stage one, two, and three. Boom, you're done.
perfect. Okay. That's the big questions that I had coming in. Um, is there or one more? Is there a good way to estimate out-of-pocket costs for Medicare plans based on healthcare needs?
Yes, so they're apples and oranges. So if you look at an Advantage plan, it's always going to have an out-of-pocket maximum. So you can look at the Advantage and say, hey, my medical out-of-pocket maximum is 39, 45, whatever the plan has put together, and you would use that number and say, hey, has Brandon allocated $4,500 if I had a very difficult medical?
Oh, did we just lose Shane? I think we just lost Shane. Okay, well, that
And
was
I'm still here, and this
oh,
is, this is why I'm still here.
there you go. Well, yeah, Jen, I mean, that was the last question I had, um, and I'm sure that's one I was curious about was just helping people estimate cost. Um, is that something that you feel comfortable tackling for a minute, or should we
Yeah,
just put that in a follow-up email?
no, absolutely.
Okay.
So Ashley was mentioning that on Medicare Advantage plans, they all do have a medical maximum out of pocket. And
Yep.
even though the prescription portion is built in, they also have a prescription maximum out of pocket.
Okay.
So for medical, if you were to add up all of your medical copays throughout the year, if you hit that, the carrier says you're done. I'm paying 100% for the remainder of that year. Clock starts all over again January 1st. Now,
Okay.
on the Medicare supplement side, it really depends on what type of supplement that you're on. The highest tiered, which is the most popular one, is Plan G. As long as you're paying your monthly premium and you are paying that Part B deductible, that's your out-of-pocket cost for the year. If you cost that insurance company $1 million, they're not going to charge it to you. You're just responsible for your premium and for that Part B deductible, and that's it for medical.
Okay. Perfect, Jenna. Thank you. We appreciate you guys. I'll kind of wrap it up. We have recorded this. This will be available on our website, and I'll work with Kyle, and I think we can send a copy of this out. Um, but we appreciate everyone attending. Thank you. Hopefully, this was valuable. We certainly welcome your feedback. Again, if you have specific questions, you can feel free to email me, or if there are specific health related questions, Jenna and Shane have been a great resource. We've had a lot of our clients who have used them over the years, and we've had great feedback. And just compliance disclaimer, we don't get any kind of compensation for working with Jenna and Shane. So it's a resource that we want to make available to you, our clients. And we appreciate the trust that you've placed in us. And we feel like we found a good partner with Shane and Jen, and hopefully they're valuable to you as well. So with that, I'll close it. And you guys enjoy the rest of your day, and we'll look forward to talking with you soon.
Thanks, everyone.